President Trump says his administration is looking to ban all non-tobacco e-cigarette products. This comes as health officials warn of a surge in vaping-related lung illnesses. 6 people have reportedly died. Fox News medical contributor Dr. Marc Siegel investigates tonight if the science backs up the possible ban. Dr. Siegel.
The Centers for Disease Control continues to investigate the cause of 6 deaths out of 450 cases so far of a sudden severe respiratory illness tied to vaping. In Wisconsin and New York, state health authorities have found that a vast majority of these cases have been associated with vaping cannabis oil products containing THC, and they are attempting to determine which chemical additives are at fault, including possibly vitamin E. Meanwhile, HHS, CDC, and the American Medical Association have all advised people to stop vaping. The Trump administration announced today that it plans to clear the market, quote, of unauthorized non-tobacco flavored e-cigarette products. This announcement is not directly tied to the illnesses, but rather to preliminary numbers released from the National Youth Tobacco Survey that show that more than a quarter of high school kids are vaping, and close to 2/3 say it's because of the flavors, while showing a lack of awareness of the nicotine content. In fact, e-cig users are almost 4 times more likely as non-users to ultimately turn to tobacco. But vaping advocates point to the decline of cigarette smoking among teens as evidence that e-cigs are actually having a positive impact, and that over-regulating them will lead to more tobacco smoking among teens.
The big news out of today's data release is actually that we just saw a record-setting 27% decline in teen smoking.
The esteemed New England Journal of Medicine published a study earlier this year which showed that e-cigarettes are a more effective tool for quitting smoking than other nicotine products like the patch or gum. So while teens are not legally allowed to buy e-cigarettes in all 50 states, and the problem is trying to enforce this, at the same time, there appears to be a benefit for confirmed smokers that is worth preserving. Mike, back to you.
Dr. Siegel, thanks very much.